challenge for the pediatrician. And I will explain to you what is this challenge. Che succede? Parto di qui. No, qui. Se ho fatto un pasticcio me lo dica. Ho l'abitudine. Ma questo non funziona più. Ah, ok. Allora abbiamo. Perché non posso usare così? No, deve andare. No, questo non funziona. Perché? Allora, ascolti, dobbiamo andare. No. Però senza quello lì come faccio io? No, devo fare così, se io faccio così e poi faccio così e no. Perfetto. Sono più bravo di lui. Sorry, it's a technological problem. I am not technological. I divided my speech in 5 sections: definitions, state of art on childhood neoplasm, infertility risk and fertility preservation option, current research, and bioethical implication. The first in this agenda is a definition. The major function of the reproductive system is to ensure survival of the species. Reproduction is the biological process by which a new individual organism called offspring are produced from the parent. In this cartoon, you can see the ants that hatch the eggs from which the chicks will come out. These will become adult ants made with cocks and hatch new eggs, ensuring the survival of the species. In the other picture, you can see a multitude of children. Each child will become the father or mother of other children, continuing the species. A healthy male or female is able to generate one or more children, ensuring the survival of the human species. Fertility. Fertility is defined as the natural capacity to conceive a child. Infertility is a disease of the female or male reproductive system defined by the failure to achieve a pregnancy after 12 months or more of regular and protected sexual intercourse. Fertility differs from fecundity, which is defined as the potential for reproduction, i.e. natural capability to produce offspring. The lack of fecundity would be called sterility. In this cartoon, on the vertical axis, there is the fertility rate, and on the horizontal axis, the age of the mother. As you can see, the fertility decreases with increasing the age of the mother. Which are the causes of female infertility? May include endometriosis, ovulation disorder, and other gynecological problems. I draw your attention on the last point, cancer and its treatment, because I will speak about this topic. And the causes of male infertility include abnormal sperm production or function and other male problems. And the last is damage related to cancer and this treatment. An important congress was held about in vitro fertilization that consists of adding a man's sperm to egg of the women in laboratory disc and reimplanting in the uterus. This important congress was held on November 26 last year at UniCamillus University. The most common types of cancer in children are leukemia, brain and spinal cord tumor, retinoblastoma, bone cancer. The types of cancer that occur most often in children are different from those seen in adults. In the past, they were always a fatal cause of death. Leukemias are cancer of the bone marrow and the blood and are the most common childhood cancer, about 28% of the all cancer in children. The most common types in children are acute lymphoblastic leukemia and acute myeloid leukemia. Acute leukemias can grow quickly, so they need to be treated typically with chemotherapy as soon as they are found. But what is this bone marrow? Bone marrow is a semi-solid tissue, found within the spongy portion of bones and is the primary site of new blood cell production called hematopoiesis. As you can see, the bone marrow generates red blood cells, platelet, white blood cells. Brain and spinal cord tumor are the second most common cancers in children, about 26% of children cancer. As you can see, the brain, called the spine, is represented by the brain and the vertebral medulla. Lymphoma starts in immune system cells called lymphocytes. And lymphocytes, you can taste lymphocytes at the neck area, for example, neck lymph node, but is represented in all the body. Is not one lymph node is pathological, is a disease. No, the majority in children are not the disease, but if this lymph node grows rapidly, this is a problem. It needs an investigation. The other bone cancers that start in the bone, most often older children, but they can develop at any age, about 3% of childhood cancer. And as you can see, the bone cancer starts from the bone in this case. What is the most common treatment for childhood cancer? Principal treatment include chemotherapy that use powerful drugs to kill fast-growing cells. It is most often used since cancer cells grow and multiply much more quickly than most cells in the body, the normal cells. It's used alone or in combination to treat a wide variety of cancer. Surgery, the most effective at completely removing cancer if it is at early stage and localized. And the radiotherapy that use high doses of radiation to kill cancer cells and reduce the tumor. The types of treatment that a child with cancer receives depend on the type of the cancer and how advanced it is. Do this therapy have a side effect? This is the question. I stop. Sorry, I have no classes.
Sorry. No, in the microphone because they can record. They can't record if you don't do in the microphone. regista.
Ha paura della telecamera.
È una domanda importante, sicuramente.
Good afternoon. Just to understand, which is the range of age that you define childhood in which you can operate with chemotherapy, surgery, and all the other options that we have? Thank you so much.
This depends on the type of the cancer and merely of if the cancer is localized or not. You can make a surgery if this cancer is developed and is invasive on the total body. So it's important to choose if it is localized and the type of the majority of the cancer of the blood and the bone marrow is chemotherapy. And another point is to perform a total body radiation and to give a bone marrow transplantation with the stem cells. So you have to change the cells in the organ, in the body of the child.
Another question? Please go there. Okay. It's very tricky.
No, io vedo da lontano con gli occhiali da vicino.
Do we know the reason why the leukemia and the other tumors are more common in the childhood? There are, I don't know, problems in the development or what?
In the other slide, you can see the difference between lymphocyte leukemia and myeloid leukemia, because they occur in the lymphocyte leukemia occurs in the youngest children, and myological leukemia in any age. But the cause is not possible to find. In fact, there are nobody with the Oscar in the end as the premium Oscar. Okay.
Okay, thank you.
Professor Bozzola is very patient. Then, it's a good patient, very patient. Then, if you have any question, this is the right day to ask him. Probably, this is my personal point of view, probably could be interesting for you to follow all the speech, because probably you can find a lot of answers in the speech. But please write your questions, and then a little bit later you can, okay? I think it could be a good procedure for you. Then, thanks.
Okay, we continue. Which the toxic effects of chemotherapy in children and adolescents? As you can see, a lot of these side effects. But I draw your attention on the number 11, the infertility, because we are speaking about infertility. In our agenda, the second point is a state of the art in childhood neoplasm. Every year in Europe, more than 6,000 children and adolescents die of cancer. In Italy, 400. Despite notable progress in recent decades, childhood and adolescent cancer is still a serious and potential fatal disease today. As you can see in this cartoon, on the left, you can observe the mortality rate of the children cancer, and on the horizontal axis, the year of the diagnosis from 1982 to 2014. Every color is for the blue for the children between 0 4 years, the red 5 9 years, and the green from 10 to 14 years. As you can see, there is the mortality decrease with development of the new treatment. This is very important for us. Questo non funziona. In the last 30 years, progress in antineoplastic treatment was allowed a significant increase in survival of the patients with neoplasia during childhood. In Europe and the United States, 82% of children, adolescents, and young adults survive 5 years from the diagnosis of neoplasia, and the most show long-term survival in adults. In this cartoon, on vertical axis, you can see the proportion of the survivor, and on the horizontal axis, years of the diagnosis. From the past year to today, there is an increase, significant increase in survival. This is for answer to your question. As you can see on the left, the acute lymphoblastic leukemia is on the bottom, and on the above you have the acute myological lymphomas. As you can see, the majority of children are affected of acute lymphoblastic leukemia during the first stage of life. It's not good explained. This is only an observation. Instead of the myological leukemia, and that there are no significant peak or modification during the life. But important for you that in the face of neoplasia, the main concern is the treatment of the disease. Profound changes in the familiarity life and the severe problem in adapting to a new situation. Marital problems, neglecting the healthy sibling, and the loss of interest in work occurred in the majority of parents, especially in mother. Younger sibling suffered from the strain imposed to the family than did elder ones. This is important because if you think you can find two brothers. The first brother is affected by leukemia, the necessity of hospitalization, the cure, side effects, and so on. The younger live in a very special atmosphere because all the attention of the parents is against the brother. And this is enabled to understand why all attention is not against him. But when you live, you operate in a hospital or in this category of a specialist, you can observe the big problem in the patient, but in the brother or sister of this patient. The patient should be promptly informed of the possible toxicity to the ovaries and testes by the therapy to which he will be subjected and the possibilities of preservation of his or her fertility in the future. Infertility due to treatment of neoplasia has a negative influence on the quality of life. Long-term complications of antineoplastic therapy have effects on reproductive capacity following the chemotherapy or radiotherapy on the gonads or pituitary gland. The risk of permanent infertility is higher in male than in female because the ovaries appear to be relatively more resistant to the chemo or radiotherapy. The impact of antineoplastic therapy is variable and ranges from a temporary inhibition of reproductive function to irreversible damage. In 2013, the American Society of Clinical Oncology published clinical guidelines for fertility preservation. However, the wide variability between the suggested recommendations lead to great discrepancies. Doctors should discuss with the patient on the risk of infertility due to neoplasia, and its treatment as soon as possible, and inform them of the possibility of preserving their reproductive capacity. Obviously, in the case of prepubertal patients, physicians should discuss this with their parents. We come back about this problem in the other slide, because a big problem for the physician, or mainly for the parents. The third point of our agenda is the infertility risk and the fertility preservation option. Risk of infertility from oncological treatment in females. Alkylant drugs such as cyclophosphamide, busulfan, directly affect the germinal epithelium, causing temporary or irreversible damage. Irradiation of the ovaries, including total body irradiation, is irradiation of all body before to give the patient the stem cells for the bone marrow transplantation. Causes of permanent damage by destroying the small follicles. In fact, the side effect of chemotherapy in female fertility, you can observe in this cartoon. On the left, the primordial follicle, on the horizontal axis, the age of the women. Blue point is the control, healthy control. The triangle, pink triangle, is the women receiving chemotherapy. Physiological, from the first year of life to the adult life, the amount of the primordial follicle decrease. But in this case, in the women receiving chemotherapy, the decrease is more significant. So the primordial follicles are not able to increase, to renovate, because the women that lose the primary folliculi is not able to have other folliculi. It will be infertile. We have a biological approach for the option to cure the fertility preservation in fertility in cancer female. Embryos cryopreservation, oocyte cryopreservation, ovarian tissues of cryopreservation. Embryo preservation is a wide setting method, but is limited to women with pattern because the sperm is necessary for oocyte fertilization. In Italy, due to legal restriction, this use is limited to infertile couples. Oocyte cryopreservation, sperm is not required, but they require the stimulation of the ovaries with gonadotropin and surgical recovery of mature oocyte. This is not indicated in a prepubertal girl because the gonadotropin is very low in a prepubertal girl. The only available method for prepubertal girl is the cryopreservation of ovarian tissue and success consequent transplantation. So we have to collect through laparoscopy an adequate amount of cortical ovarian because they contain most of oocytes. Then cryopreservation, then reimplanted with heterogeneous implant or orthotic implant, autotransplantation or in the remaining ovarian tissue. But it's very dangerous because you have a risk to reintroduce cancer cells after ovarian implantation, especially in leukemic patients. So the disadvantage is the introduction of neoplastic cells. This is a big problem. The other problem is they lose, there is a loss of more than 50% of the follicles content during the revascularization of the tissue after reimplant. The ovarian function is restored 4 months after transplantation. 25% of women will generally become pregnant. This is very interesting because tissue transplant generate more than 86 human births. Births are obtained after cryopreserved ovarian tissue transplantation in prepubertal femur, so the femur that didn't arrive till at the puberty to develop of breast and without just children in prepubertal femur with oncopathology. On the right, you can see with the flex the number of the birth in every country. For example, in Germany, 70 birth after cryopreserved ovarian tissue. In Italy, only 1. This depends of the law in the country, because in some countries it's not possible to perform an implant of the ovary. Ovo for a plus. I just.
Just a second, because this is very technical. Then for you this is very technical, but this technique is very important to explain you 4 different points, and then Professor Bozzola will explain better than me later, but you have to take in consideration. First, when we have discussed during all this course the choices, okay, you are a parent, they try to take to think that you are a parent, you have a child with a leukemia or a cancer, and then of course you are afraid for your child, and then you have to decide for her life first. Second, Professor Bozzola stressed very well the concept that there is a risk. Okay. Also, if you make the better technique, if you are very good in a good center, there is a risk. These are not perfect techniques. There is a cost, okay, because each technique has a specific cost. If you want, for example, to make a cryopreservation, you have to pay for it, because you have a machine, you have a lot of things, and then you have a tool, a lot of tools, and then you have to pay. Then we can have damage, we can have risk, we have for sure cost, and then we have also the law. Because another concept, Professor that sometimes you can't do everything. It's against the law, okay? Then it's not so easy. You are doing something that in your country is not possible to do, okay? You are making, if you are the parent of this child, you are making a lot of choices for him or for her. But if the child, as we hope, will survive, we have to explain to this child our choices, our ethical points. Then it's technical, but the technique is the background to explain to you that first you have to understand the technique, because you have to make your balance, okay? You have to think which is the good balance for you when you are the doctor, or for you if you are a parent, okay? Or for a young girl or for a young man to explain all this balance, okay? Thanks, sorry.
No, sorry. Thank you for your fluent English. I am not able to explain in this way. For PEXIS, this is surgical transportation of the ovary or ovaries out of the irradiation field for the duration of the therapy used in pre- and post-pubertal female. It must be performed before starting radiotherapy, but does not protect the ovaries from the effect toxic of the chemotherapy. It's not feasible in a chemotherapeutic treatment explained. You have to protect the area during the radiation, but if you have another risk to have a implantation of cancer cells, because in leukemic patients is not sufficient to protect the area. Success depends on the age, dose, site, and the type of pelvic irradiation. If malignant cells are present in the ovary, there is a risk of reintroducing them after ovarian transplantation. This is a big problem, because for the parent to cure leukemia is just a success, but the risk of reintroduced cells the goal is to preserve fertility, but the risk is to introduce leukemic cells, so the child will be affected another time for the leukemia. This is very discussion about the parent and the physician. About the hormone suppression of generase agonist is very technical, but no indication in prepubertal girl. About the male, chelant drugs, like in the female, directly damage the germinal epithelium, lead to no effect or irreversible damage to spermatogenesis, but does not affect the testosterone secretion. Exposure to radiation is the same. Irradiation may cause irreversible azoospermia and an effect also on the Leydig cells and testosterone production. Leydig cells are the cell producing testosterone. So the damage is against the production of the sperm. So the final condition is azoospermia. This is very well explained in this cartoon. On the vertical axis, you have the sperm concentration. On the horizontal axis, you have the chemotherapy, here amounts of the chemotherapy. And the line that they observe, questo non funziona purtroppo. This line is the limit for azoospermia. As you can see, the majority of these young women present an azoospermia. It depends on the time of the start of the chemotherapy. The sperm cryopreservation is performed only in post-pubertal males, because in younger children we are not against the testosterone. So the only possible preservation of the fertility is a cryopreservation of the testicular tissue and transplantation. So it's an experimental technique. It's not practically possibility in under pubertal children. So we have only one method to preserve the fertility, but this method is experimental, is not just approved by the authorities of our country. Protecting gonads with lead may limit radiation therapy, like in females, up to 90%. Hormonal gonadoprotection is not recommended in a prepubertal children. Procedures based on genetic technology have also been hypothesized, but the genetic manipulation is dangerous. Considerations. About 70% of young survivors are interested in having children in the future, but the number of those using a method to preserve fertility is, to date, significantly low. Why? For low information, for no information, for the problem is when the child is a disease very severe, like leukemia, his mind is addressed to the survivor. But the survivor, the preservation of infertility, I think is a last problem for him, not for the patient, the parents. In boys and girls, the possibility of preserving fertility with a standard experimental procedure requires an individualized approach based on the age, type of treatment, time availability, period of therapy, cost, and the long-term consideration. Collaboration between the various specialists is essential for developing the field of fertility preservation. I draw your attention on the cartoon because this is a sentence of a very important Lebanese poet of the last century. One does not progress by trying to improve what has already been done, but by trying to achieve what does not yet exist. This is very important for us because the genius is the physician, the man in general, which are able to find something, not to improve what the other just done. Do you agree?
Of course, of course. To be a genius is to change completely the reality of facts. Then you are looking more, you are seeing something that others are not able to see. But there is a problem for genius, you know. The problem for genius is when you arrive before others, you have the problem that the others are running at you are waiting, and then it's not really easy, okay? I'm not a genius, but sometimes I arrive a little bit in advance, and then I know that it's not easy because the easiest thing is to be in the range, okay? But when you are in the wave of Gauss, of course, if you are in the first part or the last part, you are a little bit alone. There is a romance, there is a book of Vasquez Montalban, a Latin American author, and then is the lonely situation of the manager, because usually you are completely alone when you are a genius, but it's interesting because you can see more, okay? Don't be shy if you, and this is also the aim of this kind of conference lectures. We would like to give you the possibility not to be genius at the beginning, but to become probably genius, because you have the possibility to see something more, okay? You are we know that you are overwhelmed by these presentations, by these speeches, because you don't know all the background, but this is the idea. Thanks, Professor Bozza, to have given me the possibility to explain how it's important to be a genius, or to try to be a genius.
Okay, thank you very much. Another point is the current research. In this slide, you can see the approved procedure for the preservation of the fertility in males, and on the right, the experimental phase. It's very strange because we have a possibility to preserve in a male the fertility, but it's not approved by the authorities. This is very strange. I didn't understand why. Because the scientific expert indicated this is the only possibility. But if you work in the hospital, you have to ask to the bioethical committee the possibility to perform this procedure. It is not only 1 page, 2 page, 3 page of the report. Is the amount of correspondence. And the other side of this discussion, there are a religious, a corner, and other people is not, they are not specialists. But when the patient, the parent of the patient know that the only procedure is not easy to explain them, we are waiting for a possibility to perform this procedure. This is quite a joke. Key question: is it ethically justifiable to propose experimental procedure for the preservation of fertility to a patient? It's not really a joke, because you have to explain to a child, for example, 5 years old, that a male, for example, the only possibility for him is to perform an experimental procedure. The parent knows very well the problem, but the child knows. And the child can answer that he is not able to decide. This is a big problem, and sometimes I appreciate this answer by the child, because it's not possible to explain completely what is the best for this child. There's a lot of the literature, the paper written about this field. Is an amount, very important amount. And this is one that I written with my collaborator 5 years ago about the new prospective fertility preservation in pediatric oncology patients. But I think I have improved this perspective. I'm not the genius that I found a new perspective. I am about to finish. Forse... perché non me l'ha fatto prima? Okay. The last point is bioethical implication. We have to think, to reflect about this point. Safety of cryopreservation techniques, surgery. This procedure needs a surgeon. So the surgery include anesthetic problems. Then the ovaries and the testes of the young children are very small. And when you pick up a little portion of these ovaries or testes, is not easy for the surgeon. Second, ensure that no residual cancer cells are reintroduced in the transplant, because when you have a problem, this is the second more important problem to explain by the patient, to the parents. Informed consent is another problem because it's difficult to offer reliable risk and success experience. When the parents ask me, what your experience about this fertility preservation? I am a little experience, but it's not sufficient for my child. You need to have more experience in order to propose me this procedure. The other point is the difficulty in obtaining appropriate information in face of the parent's emotional state. So the parent receive the information that their child is affected by leukemia, for example, and this child risks to die. So you speak about preservation on the fertility is a point more. It's not easy to inform the patient that it's important. This child, they decide immediately for the fertility preservation, because we have to give chemotherapy or radiotherapy, and then we cannot perform the fertility with cryopreservation of the ovarian or testicular tissue. The parents have to choose instead of the children. Precise indications are needed to correctly inform a patient and operation in the sector. We have no book, you have no paper, you have no real guideline to use to explain this problem to the parent. Take-home messages. Infertility represents one of the main long-term consequences of a combination therapy. It's difficult to individually predict the influence, temporary or lasting, of the chemotherapy on ovarian or testicular function in cancer patients. Sometimes the child, for example the male, will become a father because the alkylant drugs didn't no effect in these tissues, the ovarian, the testicular tissue. Sometimes the child will be an infertile man. No evidence for increased risk of malformation is offspring of a patient with a history of chemotherapy. We make to emphasize the role of the pediatrician when informing the patient about the possibility of preserving their reproductive capacity. Is the subtitle of my speech. Obviously, in the case of prepubertal patients, physicians should discuss the possibility with their patients. Parents of a boy or girl who is undergoing chemotherapy are psychologically depressed as a result of the diagnosis, but they must decide before starting antiblastic therapy whether to have their child undergo procedure to preserve the fertility. They have to decide immediately, because then the chemotherapy will start and they will no longer to allowed to give an authorization. The pediatrician must be of help in this choice. It is not a simple role. I can conclude with this picture. I would like to conclude my speech with this fly of a stork that bring to mother who have become fertile, a boy or girl, to fill their life with joy after so much sacrifices. Thank you for your attention. Trete lode a tutti dopo questo applauso.
Thanks a lot, Professor Bozzola. Just some comment for you guys and girls. But it's first, Professor Bozzola stressed the concept that the choices are choices to be made in a very short time. You have in front of you a patient with an important problem, and then the parents, they have to decide in a short time. And this is not the top of their problems, of course. The top of the problems of the parents is to solve the leukemia, to solve the cancer, but in general. But it's not to preserve the fertility. But it's very important. Why it's very important? First, because we have discussed many times that our choices are not stable in the life. Okay, for example, we are married with someone, and then we decided to adopt a child, but we change our partner, and then another partner could decide to have a child. And then this is an option. Then, when you discuss with the patients, my personal opinion, of course, is give to the patient or the parents of the patient the choice, the possibility. Explain that nothing is stable, and then, for example, Professor Bozzola explained that if you make some technique, you can reintroduce the cancer cells. But if the technique, for example, if you make the cryopreservation and you wait for 20 years or for 30 years, probably you can make other super techniques to purify the cell. Then the adoption, the decision, the choice, the moment of life, the timetable. Explain to all patients is important, not only in this case, but in all cases, to explain that there is a timetable, there is a clock, okay? And you have not to waste not to lose your time. And then, last but not least, Professor Bozzola talked about the bioethics committees. These are very, very, very important, because these are multidisciplinary committees. Then a lot of non-experts in techniques, non-experts in the field of medicine, but experts in other fields, for example, legal field, ethical field, religious field. Of course, they have to decide together. I don't want to give you my opinion on it, just to make a comment. Check the difference between since 20 years ago to now about all the techniques on fertilities. Okay, 30 years ago were completely new and non-accepted from a lot of people, and now are accepted, are legal, and then it's important to make this balance. If you have any question, this is the moment, please.
So I have a couple of questions. Two of them are more like medical, two of them are more on the bioethical point of view. So the first one is, so when we take a graft from somebody that is very young, then the preservation in the long term, of course, takes a lot of money and a lot of procedures. I wanted to ask, how much is the impact of re-implanting a tissue in an adolescent or a 20-year-old after preserving the tissue for this long time? Because the tissue is of course going to change due to development and of course of chemotherapy that is going to not change the anatomy but at the tissue level. So how does that impact the process? And should I ask the other questions?
No, I can answer to you the first question. When we have to treat a leukemic patient, for example, you need first the chemotherapy. Chemotherapy is very destroying therapy because the child is very suffered. But you need then total body radiation because we have to irradiate the cancer cells of the bone marrow and the blood. And this is very, very important point. Then you have to find a organism, for example, a father or a mother, we have the same type of bone marrow to implant in this, to graft this child. It's not easy because the majority of patients have a special bone marrow is not completely identical to the father or the mother. It's similar, but it's not. And this produced a condition of disease, important disease, because it's the grafting disease. So the child is not completely transplanted. The possibility of the reimplant of the cancer cells is very rare. But as you know, sometimes this is possible because it surfaces one cell, leukemic cells, to introduce in the body to develop new another leukemia, for example. But this is a risk that everybody accept to cure the leukemic patient.
Okay, thank you. So then I have another question, just like sort of something medical and bioethical at the same time. So you said that it's not been approved by the authorities in Italy, I guess. But I was wondering if something in the long term, obviously. So let's say that the patient dies, but they have given the graft for a reimplantation in the future. What happens to the graft, and would it be possible for, of course, we have a compatibility between like the donor and who receives the graft? Is there a possibility of interchange tissues, or is it something not possible?
It's a very difficult question. My compliment, because only in the meeting you have this discussion with the expert, but you have not expert, I think, of a leukemic patient. But I try to explain. There is a bank of the bone marrow in the world. So, for example, for this child need a bone marrow found in Israel, for example. And these kind of cells, stem cells, arrive from Israel. But sometimes you have no compatible bone marrow. So you have to accept a quite similar bone marrow. And this is the problem. And sometimes the leukemia recurs another time. But luckily, it's very rare, luckily. But it's possible. And for the parent, it's difficult for the physician to explain to the parent the possibility of a reimplantation of the leukemia. Luckily, I am a pediatric endocrinologist, so I have not to have this problem with the parent. But I worked in a hospital, in a pediatrician department, and I had to discuss with the parent about this problem.
Okay, last question. So you were talking about the fact that during life we all take choices that are unstable, so we may change or we change our choices, right? But in this case, I think the question is more, do we, like, it's either to have a choice or not to have a choice. So when it comes to talking to parents, I would mostly concern to the fact that, do we want our child to have the choice in the future to reimplant the tissue and potentially have a child, or do we not want to have that choice? So I think that it's the problem is more to focus on this topic rather than not to take this choice and not have the choice.
I agree with you. Of course, it's better to have a choice more than a choice less. But it's clear for me. This is my light to be followed. Of course, but the problem is not if you have a choice or if you have not a choice. The problem is when you make a choice, there are a lot of other choices at the same time that you have to make. Okay? Then first you are asking to make a sacrifice, for example, in terms of cost. Okay, and then you are make, for example, you are this is like when you promise something. Oh, of course you will arrive to have a child in the future. Probably not. Then. Because in our job, I talk as a doctor since a long time. In our job, we try to give the best our side. Okay, we have to explain to the patient that he can do more, not less. Okay, if you have in front of you a patient with a cancer, you explain that he can do. Okay, you say you don't have anything to do. Okay, first because the depression is not a good background to start any therapy. The problem in terms of choices is a very important problem when you have young people, okay? Because when you have parents, the parents can make their choices and then they are responsible. Of course, they are adult, responsible, but take in consideration the problem of religion. Okay, not all the techniques are available for all the people. Then, when you offer something in terms of technique, you have to take in consideration, on the other hand, that probably you can have a negative answer, okay? I don't explain a lot on it because we have discussed in the past. But when you have young people, for example, we have discussed in a small group on some movie. For example, one of these movie was The Court. There was a judge, and the focus was on the blood transfusion. Okay, but when you have someone of 17 years old, okay, 15, 14, okay, this is a patient, is able to understand, is in a important crisis of his or her life, okay? And what do you have to do, okay? You don't have, first, from the ethical point of view, not to say anything not realistic, okay, if you think. But to take in consideration also that the techniques will change and then will improve. And then if you have a tissue, but to explain also that, for example, an adoption could be a possibility. Okay? Because when we discuss with the patient, we discuss in terms of balance. What is less dangerous and what is more preferable for the patient. Okay? For here, then, we have different categories of infertilities in young people. Children are about till, I think, 10 years old. After 10 years old to 17, and then each year is more difficult to explain the cancer, to explain the therapy, to explain the possibility of life. Then, last but not least, if you remember, I don't know if you remember the cartoon of Love Is. Do you remember the cartoon Love Is Something? For example, two small baby. Okay, check on your laptop. Or Love is a cartoon. Okay. Love is 3 points, and then you see a small young girl, a small young boy, and the love is to stay together for the life. Love is to do this and this and this. Okay? Okay? Have you seen? Have you checked? Love is. Okay? This is a cartoon. For example, the lady who invented this cartoon decided to have a baby after the husband died. Okay? And then if the parents decide to, for example, to use this tissue after, could be, it could be. If you have a bank with a tissue, you can do a transplant, you can buy eggs, or you can buy sperm, for example, to create a grandchild. Do you understand the problem? Yeah. It's a very, very, very difficult problem. And then the limit, this is an ethical limit. I told you about Love Is because 40 years ago it was a very, very big issue, the decision she made. then it's important, it's very ethical, we are not outside of this course. If you have time, please read something on it, because it's very interesting. Because it's the first case was the case of this designer, this lady, but I think is not now is more common than before. Okay? Thanks a lot.
I'd like to complicate your life because the problem of leukemic patients is not limited to this procedure to perform, to permit, to allow the fertility preservation. Because after total body irradiation, this kind of child can present a deficit of hormone, because total body irradiation is able to irradiate cancer cells and the other cells. So, for example, it irradiated the hypophysis, the pituitary gland. The child loses the growth hormone, the hormone of the growth. So you have to treat this child with a substitutive therapy with the growth hormone. But the growth hormone, in some cases, is not permitted, is responsible of some tumor. In my opinion, no. But 10, 20 years ago, a lot of questions are raised about this possibility that growth hormone can allow the leukemia, for example. Today, this is not discussion, but for the parent, I recommend the treatment with growth hormone to the child. We received total body radiation, and the question is not possible that your treatment could lead to another leukemia? This is the question. But I stop, because this is a very open discussion. At this moment, no like 20, 30 years ago. Okay?
Another question, because another question for you, because it's matter of your thoughts. Could be. For example, when we make a treatment for fertility, we are more or less sure that the baby will be normal. Okay? If the baby is not normal, how after a treatment, in the sense you make your preservation of fertility, there is the cryoconservation. After 20 years, you decide to use these cells, etc., etc. And if the baby after is not normal, because no one explains to you that there is you can't be sure about your baby, okay? But the last case, not in this field, but in another field, has been the mother in Ukraine who decided to leave the child. Do you remember the case? A couple of parents, of Italian parents, decided to ask a mother to make a child in Ukraine, okay? Because I don't remember why she couldn't make a baby, probably she didn't have a uterus or something like that, okay? But after, when the child was born, the couple, the Italian couple, decided to leave the child in Ukraine. Because to have a child is a problem of responsibility. It's not a problem only of preservation of fertility, of techniques of fertility against infertility, etc. It's also a problem of the time after the child delivery. Okay, then if for example if you make all this roadmap, and then at the end of the roadmap you have a child in your arms not with problems, then are you prepared? Because if it's a natural child, more or less you can be. After something like that, I am not sure. But please, you can answer. And then,
I can try. Well, okay, it's no.
for the people at home, it's better if you speak a lot.
Okay, I'm trying. I can get a little bit emotional because when I was just a child, one of my cousins has really a really bad deformation. Then he died when I was 5. When he was 5 and I was 8. So it's a topic I really care about. Okay, since I experienced it myself, and I think that it doesn't. It's okay. It's it can since easy to say since I don't have children, but I think that if it would happen to me, I think I will not be able to abandon a child just because he has some deformation or some. I mean, maybe if it's happened when the person is pregnant that I know before and I can choose abortion, I would. Maybe I would choose it, but if it happened and I don't know before, I would not be able to just keep on with my life and don't care about it.
I understand, but the problem is that in Ukraine, the child abandoned by the couple, the Italian couple in Ukraine, was perfectly normal. He didn't have any problem. Then imagine if a couple is able to leave a child with like a garbage, if you want, without problems, then this is an ethical problem, okay? This is not a personal ethical problem, but it's a bigger issue. This is a general ethical problems, because when we have laws, when we decide on laws, we decide for general ethical points, okay? The problem is that you can be very responsible, and you can be in the position not to do something because anyway the law doesn't give you the permission, doesn't give you the possibility. Then it's not easy, but you have also, because sometimes when we read the laws, we think that are not correct, are against us, we have other ideas, but take in consideration the ethical points of view and the real protection of vulnerable people.
I think that being a decent person is to to be able to be responsible of our decision, because it was firstly our decision. So if I'm a decent person, I take my responsibilities, I think.
Not all the people, but it's possible. Do you have other questions for Professor Bozzola? Do you have other comments? I know that this topic is important, and this topic pushes you to think about, because this is a real problem. You can read on this problem, or on some problem very close to it every day in the newspapers.
No, I think that if a couple decide to abandon a child, that couple was ready to have a child, or it was so mature to take its responsibilities. Because when you decide to have a child, you have to think about your responsibilities. I'm not judging, but having a child is to take our responsibilities. And if you decide to abandon, I'm sorry, but you are not a beautiful person. My opinion is just like this. And I have a question for Professor. All operations here in Italy, where which of the operation you can have in Italy, and where, of course?
Which kind of
Which kind
surgery?
of operations you can have, and where you can have those?
Of surgery.
Cioè, dove se in Italia sono legali, cioè a tutte quante.
No, I understand. The operation is a surgery for you.
Surgery.
Surgery is only for the disease well localized. For example, liver. Liver, you can perform a transplantation of the liver. If you have two surgeries to pick up the wrong liver and to transplant another liver of a donor, for example, but the same age, not the same sex, but the same age, because the problem is the size. This operation in Italy is very rare. The hospital, for example, in Sicily there are or at Turin, for example, or Milan. It's very, very rare. But the results are not similar. It depends also the luck, I have a question for you, for everybody. I am grandfather. For example, a grandfather, myself, a grandfather, have a child, a girl. This girl is affected by leukemia. I have to choose if this girl will be undergo the fertility preservation. I answer yes, I accept. This ovary tissue is performed in the cryopreservation and so on, but the duration is 10 years. After 10 years, it's not possible to reimplant this kind of cell, of tissue. This child, for example, died. I have to choose if you use this cryopreserved tissue and reimplant in the uterus of another woman in order to have a son. My question is, in your opinion, the grandfather, the grandparent have a girl died, have the possibility to have another son with another woman, What did you choose to do? Performed a implant in the uterus of another woman, a donor, and have a son of your son, or you prefer don't use this kind of tissue. After they died, the death of the girl, of the son.
Yes, because you have a tissue. The problem is when you have this tissue. Sorry, when you have the tissue, the problem is what do you do? There is a long discussion. There is an important discussion in the academic, scientific world on, for example, the opposite who never utilized by centers. For example, when there is a problem of infertility, they push you to make a lot. Then all these eggs, what they do? Because these are, for someone, these are embryos. For someone, these are 4, 5, 4 or 8 or 6 cells. And then that's all. There is an ethical problem with this tissue. What do you do? You can utilize, but it's an open question. You don't have to answer because this is an open question. When you have, for this reason, I told you before to check this case about Lavis because it was the first. So. Okay, I think that now we can stop. Then there is another problem, but we discuss later. Out of records. Then, because it's very specific, but there is another problem now existing. Then I think that now we can close this course of lectures. If you have any question, you can write to anybody of us. Then if you want to remain, for example, to stay in touch with Professor Bozzola or with someone of other colleagues who discussed with us, you can let me know. And then if you have a question for me, for Professor Canelli or me, no, we are available. Then I think that it has been interesting for you today to have this overview. The book, you have the book. If you now you have more ideas than at the beginning, and then I think that we can close now the course. And thanks everybody for to be here with us. And thanks to Professor Bozzola.